Deep vein thrombosis, often called DVT, is a health condition that affects the veins in the body. A vein is a type of blood vessel that carries blood back to the heart. DVT happens when a blood clot forms in a deep vein, usually in the leg. The clot can block blood flow and cause swelling and pain. This condition is important because if the clot breaks free, it can travel to the lungs. This is a serious problem known as a pulmonary embolism and can be life-threatening. Knowing about DVT is vital for everyone. It helps in recognizing the symptoms early and seeking medical care promptly. Understanding DVT is crucial not only for those who are at risk, but also for their families. Early detection can make a huge difference in treatment outcomes. DVT is a common condition with millions of cases every year. Despite being widespread, many people do not know they have it because the symptoms can be subtle. Raising awareness about DVT is the first step in reducing the number of cases and preventing complications. It is essential to talk about DVT because it affects people of all races and ages. However, some groups may be more vulnerable due to genetic factors. By understanding DVT, people can better advocate for their health and seek appropriate treatments. Let's dive deeper into the symptoms and causes of DVT in the next section. Recognizing the symptoms of DVT is key to catching it early. Common symptoms include swelling in one leg, pain or tenderness that might start in the calf, and a feeling of warmth in the affected leg. Some people may also notice redness or discoloration of the skin. These symptoms can vary in severity and may develop slowly or suddenly, making it crucial to pay attention to changes in your body. DVT can have several causes. One major cause is prolonged periods of inactivity, such as sitting during long flights or car rides. When the legs are not moving, blood flow can slow down, leading to clot formation. Additionally, surgery, especially on the legs or hips, can increase the risk of DVT. Other causes include certain medical conditions that affect how the blood clots, as well as being overweight or pregnant.
Certain lifestyle factors can also contribute to the risk of developing DVT. Smoking, for instance, damages blood vessels and can make blood more likely to clot. Age is another factor. As people get older, their risk of DVT increases. Family history plays a role too. If someone in your family has had DVT, you may be more prone to it as well.
Understanding these causes is essential for taking preventive steps. If you suspect you have DVT, it's important to contact a healthcare provider immediately. Early treatment can prevent serious complications, and sometimes, just knowing the symptoms can be the first line of defense. Preventing DVT involves making small changes to your daily routine. One of the simplest ways to reduce risk is to keep moving. If you have a job that requires sitting for long hours, make it a habit to stand up and walk around every hour. Stretching your legs and staying active improves blood circulation, which can help prevent clots.
Another important prevention measure is maintaining a healthy lifestyle. Eating a balanced diet and staying hydrated are vital for overall health and can lower the risk of DVT. Avoiding smoking is also crucial, as smoking increases clot risk. Regular exercise, even light activities like walking or swimming, can strengthen the cardiovascular system and boost circulation. For those at higher risk, such as individuals with a family history of DVT or those undergoing surgery, additional measures might be necessary. Compression stockings can help by applying gentle pressure to the legs, promoting blood flow. In some cases, doctors may prescribe blood thinners to reduce the risk of clots. These medications require careful monitoring and should be taken as advised by a healthcare professional.
Education and awareness are powerful tools in prevention. Knowing your risk factors and discussing them with your doctor can lead to personalized prevention strategies. Whether through lifestyle changes or medical interventions, taking proactive steps can significantly reduce the risk of DVT and improve overall health. DVT does not discriminate. It affects people from all racial backgrounds. However, research indicates that certain racial groups may experience different prevalence rates. For example, studies suggest that African Americans may have a higher risk of developing DVT compared to Caucasians. Genetic factors, access to healthcare, and lifestyle differences might contribute to this disparity.
Hispanic and Asian populations tend to have a lower incidence of DVT, but this does not mean they are immune. Factors such as immigration status, language barriers, and cultural differences can affect the likelihood of diagnosis and treatment. Ensuring equal access to healthcare services and education is essential for these groups to manage their risk effectively.
Treatment for DVT may also vary across different racial groups. Some individuals may respond differently to medications due to genetic differences. This highlights the importance of personalized medicine, where treatments are tailored to the individual's genetic makeup. Healthcare providers must consider these differences when prescribing treatments to ensure efficacy and safety.
Ultimately, early diagnosis and treatment are crucial for all racial groups. Encouraging regular checkups and raising awareness can help bridge the gap in healthcare disparities. Understanding and addressing the unique needs of each racial group can lead to better health outcomes and reduce the overall burden of DVT. By working together, we can ensure that everyone has the tools and knowledge to prevent and treat this condition effectively.